Welcome back. We are taking your calls about Parkinson's disease today. Dr. Dean Sutherland is a Suncoast neurologist, and he's here to give you free medical advice right now. All you have to do to get free advice about Parkinson's disease is call 552-3130. 552-3130. Right now we're taking your calls live on the air. Good to see you again.
Hi, Heidi.
Tell us about Parkinson's disease and how it affects us here on the Suncoast.
It's a disease that affects 1 to 2% of the entire population at some point. So that means there are at least 5,000 patients in our local area that have Parkinson's disease. That's a lot of patients, and that includes a lot of caregivers that are associated with that, their spouse or their children. We think that it affects approximately 15,000 total.
Here on the Suncoast?
Yeah.
All right. Well, we have a caller on the line now. It is Kathy from Bradenton. Hi, Kathy. What is your question about Parkinson for Dr. Sutherland?
Hi, Heidi. Yeah, listen, my mother has Parkinsonian. Could you tell me if that's related to Parkinson's, and how likely would I be to get that disease? And I'll hang up and answer.
Good question. What is that?
That's a great question. Parkinsonism, or as you refer to it as Parkinsonianism, is when you have symptoms that look like Parkinson's, but you can't really be diagnosed with Parkinson's disease. So Parkinson's disease is caused by loss of dopamine, which is a neurotransmitter, in a very particular part of the brain. Parkinsonism can be caused by a lot of things, little small strokes, increased pressure inside the brain. Certain medications like Reglan can actually cause it. Depression can cause Parkinsonism as well. So Parkinsonism is more a description of slow movement, gait, sometimes some problems with your emotions. Whereas Parkinson's disease is very specific to this one process, of which most people have a resting tremor, as well as the problems with their walking and their balance and their facial expression.
And is that caller likely to get it if her mother has it?
No, she's not likely to get it. The likelihood that you'll get Parkinsonism is very low if your parent has it. If it's truly Parkinson's disease, the risk is slightly higher, but still it's very small.
Okay. We have another caller on the line, Dan in Sarasota. Hi, Dan. What is your question about Parkinson for Sutherland?
I'm in my mid-60s, and a year or so ago I developed just a slight tremor in my left hand, and it just hasn't gotten any better, any worse, and I wondered, is that a early sign of Parkinson's, or is that just a sign of getting older?
Tremor can suggest that you have Parkinson's disease, but it doesn't always mean that. If you have a tremor that's at rest when you're not doing anything, then that may suggest Parkinson's disease. A lot of patients, though, and most people, even with age, can develop a tremor related to doing things. It's called an essential tremor. When they're trying to do something, it gets worse. When they're at rest, it gets better.
I have one already. All right. Let's go back to the phones now. Caller, are you there? What is your question for Dr. Sutherland? Hello, are you there? I think we lost that person. All you have to do is give us a call right now, 552-3130, if you'd like to ask Dr. Sutherland about Parkinson's disease. Now, there is a group in town that aims to help people with Parkinson's disease because it's very confusing to manage. It's called Neuro. Dr. Sutherland heads it as the medical director. I'm on the board. And it aims to provide a really important service. Tell us about it.
Well, we have a lot of patients in the general area. We have a lot of resources that are available. Over the last 7 years or so that I've been practicing in this town as a neurologist specializing in Parkinson's disease, it's become obvious that there are resources that are available, but they're not really gathered up into one place, where you can easily access them. That's really what Neuro Challenge does for us. One really important aspect of what we're trying to work on right now is we have a patient and family advocacy program that we're on. We're trying to have volunteers who have knowledge about Parkinson's or nursing, social work, things like that, that can talk to their peers basically and talk to other people that might have the disease to help us out. We know that there are a lot of very intelligent people with a lot of training in this town who can help us out with that. So we're actually asking for people to call in and to give us their expertise if possible. Okay,
so if you're interested in helping out at Neuro Challenge, you can go ahead and call the hospital 917-1000. Also coming up to benefit Challenge, there is a golf tournament in October. Tell us about that, Dr. Sutherland.
Golf tournament is going to be great. It's going to be out at Heritage Oaks. Right now it's being organized mainly by Mark Bisgeyer, who was here a couple weeks ago. It's going to be fun. We're going to have a regular golf tournament. There's going to be prizes. There's going to be a dinner at the end. Overall, we expect as many people who are Parkinson's patients and are golfers at the same time to join us, but we also want other people. We want doctors, nurses, anybody who's interested or has a family member in Parkinson's disease. With Parkinson's disease, join us. It's going to be fun.
And that, of course, will help the people who do have Parkinson. We have another caller on the line. Sharon is on the phone. Hi, Sharon. What's your question about Parkinson for Dr. Sutherland?
What are the first stages that you would notice in Parkinson's?
What would they be?
So many patients, the first thing they'll notice is a tremor, as the gentleman had called in earlier. So that might be one of the first things that you would tend to see. But other people can have shuffling or stumbling. They may have a lack of expression, and people may think that they are upset when in fact they're not. Your balance may get bad. Those are kind of the four main things that we tend to see first. Now, sometimes people present in a weird manner. They may have sudden anxiety attacks, or they may have problems with sweating episodes or low blood pressure. But in general, most times it's usually tremor and gait and balance problems with walking, falling.
All right. Well, thank you so very much for coming on and helping our viewers. We certainly appreciate it. And if you'd like to help the people who have Parkinson here on the Suncoast, remember, you can go to that golf tournament. You can also go to mysun.com and click on Health Smart for more information about that. We'll be right back.